The foot of a diabetic patient that has a potential risk for pathological consequence, including infection, ulceration, destruction of deep tissue. It is associated with neurologic abnormalities with various degrees of peripheral vascular disease. Metabolic complication of diabetes of the lower limb is significant. Diabetic foot, it is estimated that 15% of patients with diabetes will suffer from a diabetic foot during their lifetime. Although the accurate figure is difficult to obtain, but the peripheral of diabetic foot ulcers is around 4 to 27% in different studies that you look at. Approximately 20% of the hospital admission among patients with diabetic are related to diabetic foots. Overall, the rate of lower limb amputation, which lead to this mobility and sedentary lifestyle, and the patient lose most of his activity. Unfortunately, the overall rate in diabetics is 15 times higher than non-diabetic patients. It is estimated that approximately 50 to 70% of the lower limb amputations is related to diabetes. In Saudi Arabia, 13.5% of diabetic patients refer to neuropathy clinics, and 7.7% undergo chronic hemodialysis. Amputation is required between 12 to 62. Around 19% of diabetic patients will have ulcers and can lead to amputation in Saudi Arabia. It is a pretty prevalent disease, as you can see in the graph in our study. Also, it has been confirmed in the second study that was published in Al-Hasa. Remember that the pathophysiology and the risk factor for diabetic foot, it is divided into between neuropathy, losing sensation, and angiopathy, which is related to vasculature. And this is what you have to always remember. Checking your patient vascularity and checking his sensation is critical in preventing complication of his diabetic foot that will lead to amputation, unfortunately, and will lead to further complication of the patient. So the diabetic foot assessment is you have to ask for prior history of foot ulcer, and you have to look for the appearance of the foot, the color, the nails, symmetry, swallowing, deformity, and you have to assess the skin. If there is hair, the color, the thickness of the skin, if there is any cracking, and then you can advise the patient to take care of that rather than getting more cracking into the skin that will lead to further infection, will lead to further complication of the diabetic foot. You have to assess his circulation, and you assess his sensation by a 10-gram microfilament test once every time that he visits. It's important to check that before your patient will lead and go into the full diabetic neuropathy and he lose total sensation. You have to investigate and discover it much earlier before he goes into this complication. And you have to inspect the patient footwear. Unfortunately, in Saudi, there is a lot of footwear that are unsuitable for diabetic patients. It will lead to further ulceration and friction, which will cause further infection and further complication. Diabetic foot risk categories is very obvious, seen in this table, and you can go through it or keep it in your clinic. Foot care, you always advise your doctor. If you have a neuropathy, you always ask the patient to tell his physician if he have neuropathy. You ask your patient to check his feet daily for any cuts, blister, redness. You ask him to wash his feet daily and dry it carefully, especially after wudu. He have to dry it rather than to leave it wet. Use lotions to prevent dryness. Do a regular nail cuts. Wear stocks and well-fitting shoes. Never walk barefoot, even indoors, which is unfortunately a common misbehavior that diabetics do. Do ask him to quit smoking and controlling his diabetes.